Okay, hopefully this is recording. Yes, it is. Great. Good, good, good. So this is recording, and as I say, I apologize. I just want you guys to be able to hear this when you need to listen to it. So this is going to be exam 2. And like I said to you all, it's going to be based on respiratory. It's also going to be the chapters basically we covered, all right? Dermatology, ears, eyes, respiratory. Okay. Also decongestants as well. So the types of things that I want you to be aware of, for instance, are antihistamines. I want you to know some of the common side effects. Remember we talked about antihistamines, yeah? And we said that some of them cause drowsiness, but some of them don't. So it would be good to know the side effects of antihistamines, correct? Guaifenesin.
Well, can you spell that, please?
Look it up, guaifenesin, I'll give it to you, but it's under decongestants, Guaifenesin, guaifenesin. So what does guaifenesin do? Need to know it. Remember I mentioned a herb that's used for colds? Remember? Echinacea? Did you say that? Hold on. Yeah? Okay. Bear in mind the types of things that you would teach your patient to take with an antihistamine. A dosage calc, just basically mils. How many mils? Pretty straightforward one. All right, aminophylline. Aminophylline, what does aminophylline do? Remember what aminophylline is? Aminophylline. 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 What does it do? Okay, we're talking about respiratory drugs, right? Aminophylline. Remember I said it downstreams to caffeine, my favorite thing right now. And xanthine, aminophylline. What does it do? What does it do? Xanthine derivatives, that's part of it. So what's a side effect of it? When you drink caffeine, what could be one of the side effects of drinking caffeine? Yes, good job. Palpitations, right? Some people get that. There's other side effects too. Okay. Asthma. What's the initial med that you're going to use? Mm-hmm. What is it? SABA. It's a SABA, short-acting beta agonist. Okay. Bear in mind some of the other meds that we use for asthma. Anybody name any of the other meds that we might use? One of them's oral. Well, yeah, absolutely. Remember I said montelukast, right? It's given every day to reduce histamine reactions. It's a chronic med. Remember the difference between your inhaled corticosteroids and your SABA? Which one comes first?
The steroid comes second, and the short-acting is first.
Yeah. Side effects of a SABA. What type of side effects can a patient get when they take their inhaler? What type of teaching are you going to teach your patient for their inhaler for steroids? Remember we talked about that? But why?
Because the fungus. Fungal.
Candidiasis, yeah.
You said that was for steroid inhalers?
Okay. Let's see. Know your theophylline levels. Remember, that's one of those drugs that I said has a narrow therapeutic index window, right? So that's one of those drugs that you need to know the drug level, what's toxic and what's not. Metered dose inhalers. Remember I talked about spacers can get used to help a patient. What is a LABA? A long-acting, right? So is that something you would use acutely?
No.
Or is it more prevention?
Not to be used for emergencies.
Correct. Okay. Retin-A. What's Retin-A? Trentoadin. What's that for? Acne. Yeah. What type of effect does that cause?
Dryness.
And
Redness.
teach your patient that, right? You're not going to go in the sun. What about povidone iodine or betadine? What type of patient? You're going to ask about allergies, right? For those patients. Iodine allergies. Yeah. What types of foods would? Thank you. Impetigo. Anyone had a kid with impetigo? No? Lovely, delightful little thing. Yeah. Anyway, it's a bacterial type of infection, not like the big fur uncles, but impetigo. So you would use an antibacterial med like miraparison because it's still a staph or strep type of infection. What type of topical thing cream would you use for somebody with burns? Anybody remember? Burns. Remember I said I love this med? Silverdene. Silver sulfidine. Silver.
My grandma talked about this before.
Silverdene is excellent for burns. But if you have a sulfur allergy, you're not going to use it. Candidiasis. What's candidiasis? What is it?
Like blistering in the skin.
Fungal infection. Fungal infection. So remember creams. They might need to use creams for the fungal infections, right? Let's see. I know you guys, we haven't really talked about pressure ulcers, but have you talked about them yet in funds? No. Yeah, a little bit maybe? Yeah. Okay. Okay. Remember I talked about certain wounds and that certain debridement meds that can be used, and the one that would be okay if patients have issues with, say they're on Coumadin, right? And we're monitoring their PT and INR, then there's a certain debridement wound care treatment that we can use, Remember I talked about that? Anybody remember? What is it? Those of you that are nodding, which one was it? Santal. You need to read up about that. Okay, if a female is started on iso...
How do you spell that?
Santal?
Yep.
Yeah, S-A-N-T-Y-L, Santal. Collagenase. So remember, if a female is on isotretinoin or Accutane, what's the big deal about that?
Had two contraceptives.
Oh yeah, can't get pregnant, right? Okay. Remember I said if people have staph infections, anybody know the big long name, and we put 4 initials for that? Anybody know? Yeah, MRSA, right? So I just mentioned impetigo, and I mentioned a medication that gets used for that. What medication was that?
You just said antibacterial medication.
I did, yeah, but I called it something. Muripericin or bacitracin. Okay, so if you see staph or strep skin, they're usually going to use something like bacitracin or muripericin. There's other ones as well, but those antibacterial types of meds, creams rather. If somebody has a sulfur allergy, do you think that silver sulfadiazine is a good idea?
No.
All right. Hopefully you'll get that right then. I want you to know common adverse effects of trentoin, retin-A. Remember we talked about retin-A? Yeah, it's excellent, but can have some effects, right? All right. So, again, remember isotretinoin. I think we talked about this a little bit. Can't remember if I did or not. Normally I can remember pretty much everything I talk about. One of the side effects of isotretinoin, obviously we don't want them to get pregnant, but there's another big issue with it, which is risk of suicide. And I can't remember if I mentioned that or not. I want to say I did, but maybe I didn't. So, all right, glaucoma. Can't do these eye drops without glaucoma, right?
Mm-hmm.
Now, one of the meds that I didn't talk about, by the way, what are we trying to do with glaucoma? We're trying to reduce intraocular pressure, right? That's what we're trying to do. There's various meds that we can use to do that. One of the ones is an osmotic med, and it's called mannitol. Now, mannitol gets used as IV fluids to help reduce pressure, but it can be used as an eye drop to reduce intraocular pressure. So, mannitol, I want you to know about that. Okay. Remember I talked about eye drops that can cause blue eyes to turn brown? Do you remember that? Yeah. Any idea what type of med that was? Yeah, latanoprost. Yeah. Love latanoprost. When you're using it, it's a prostaglandin. Yeah. And I keep forgetting what it's called. Latisse, that's it. But in this case, Latisse is just for the eyelashes. But yes, latanoprost. It says prost, it's a prostaglandin, right? All right. How are you going to put your eye drops in?
One eye first.
Yeah. Where are you going to put them?
Oh, you gotta hold it.
Right, but where are you going to put them?
In the conjunctiva?
Yes.
So we-
Eardrops. Some of very few eardrops can go in the ear if you've got a perforated eardrum, but pretty much you're going to do eardrops and a perforated eardrum. Good job. Yeah, but basically, good job. But if it just says the use of many otic preparations, if they've got a perforation, you're not going to do it, right? Generally speaking, other than those two. But good job. All right.
So don't, for that question, you're not putting anything in your ears if they have that.
Yeah, generally speaking, don't, yeah, yeah, if somebody's got a perforated eardrum, unless the question said, would you give ofloxacin or neomycin? You would give ofloxacin. But if it's just saying, would you give eardrops for a perforated eardrum? The answer would be no. You're not going to get it if it's perforated. Do you see where I'm going with that a little bit? If it gave you specifics of different drugs, great, but if it doesn't. Okay. All right. Antibiotics and steroids for the ear. So both have different effects. An antibiotic obviously is going to work on the infection. What do you think a steroid might do?
Reduce inflammation.
Excellent. 2 points for this end of the room.
Just for that.
I want to hear it from this end. Should do Jeopardy, right? Earwax emulsification. Remember they did Brox? Types of things. What types of things for the ear, if you've got stuff going on in the ear, would you not give a emulsification for? What might be happening? One of them you guys just mentioned, we talked about.
Oh, perforated eardrum?
Correct. That would be one.
Buildup of earwax.
Well, that would be why you use it, but what would be a reason that you wouldn't use it? Drainage, right? Because if there's a lot of drainage, and it could be there's an infection, you don't want to put an earwax, you don't want to put something in there that might push that infection further in to the ear. Okay, does that make sense? Okay. All right. Let's see. Pretty much, on the whole, know what you're using a meiotic eye drop for. A meiotic eye drop. Meiotic eye drop. When we say meiotic, what happens to the pupil? Remember? As opposed to mydriotic. What's the difference? Yeah, makes a pupil smaller. Makes a pupil smaller. What about that? Remember when we looked at the eye briefly a little bit, and it had that ciliary body and that area there, that when we give myotics, it causes the pupil to go smaller, and it helps that ciliary body to open up, to allow that angle to open up so that what? Drainage of what can go out? Anybody remember? Intraocular drainage. So it can drain a bit better to reduce intraocular pressure. Why would we want to reduce intraocular pressure? Yeah, it's what you would use your myotics for. You've been studying, both of you. All right. All right. Eardrops. How are you going to give your eardrops?
Up and back and down.
Mm-hmm. What about, would you give it cold? No. Okay. And you might want to put a cotton ball in there as well, just a dry one possibly to keep it there. May do. Okay. What about the nasal decongestants? What could be a risk with that? Anybody remember what we talked?
Rebound.
Rebound what?
After 3 days.
Rebound congestion. You guys were listening. I really expect like 90 to 100 from every single one of you with this.
What is it called?
I didn't hear what she was saying.
She said you're giving us false hope.
Oh, you've got it. You've got this. You got this, right? Just have to, you've got it. Let's think about this. So, adrenergics, if you see the term adrenergics, what does that say to you? What does it do?
Adrenaline.
Yes, so what does it do?
Elevates stomach rate.
Speeds things up, right? It's going to speed things up. So it doesn't matter whether I'm talking about an adrenergic nasal spray or an adrenergic blood pressure med or an adrenergic respiratory med. It doesn't matter. It's potentially going to speed things up, isn't it? Heart rate, that type of effect, yeah? So bear in mind that key term, because if you give something that's an adrenergic nasal spray like Afrin, what could it do systemically?
Make your nose run.
Well, think about what I just said. Pardon? Well, yeah, but what's the adrenergic effect? Okay, but what's the adrenergic side effect of it?
Palpitations, high blood pressure, right?
Speeds things up, yeah? It's going to still speed things up. Okay, we're using it as a decongestant to dry the nose and all that stuff. Great, vasoconstriction. But it can speed things up, yeah? So think about the adrenergic effects that can happen. Maybe I made that complicated. I don't think so. How am I doing? Oh, good grief. Hope I get through these. All right. If somebody has thick secretions, what type of medication might get used?
A decongestant.
A mucolytic. So look up your mucolytics. Okay. How many days do you use a nasal decongestant for?
3 days.
Remember I told you I needed you to know about mechanism of action of a cough medication. Do you remember that? I said it was going to be on the exam.
It numbs the cough receptors.
One of them does. One of them does. Dextromorphan. What does that one do?
Extra what?
Dextromethorphan. Can never pronounce that properly. Go to, yeah, there's two, one numbs, the other works on the medulla, on the actual cough reflex. Okay. Okay.
So the dextromethorphan, that's the one that works for the cough.
It doesn't numb, it actually works more centrally. Okay, so it causes some drowsiness because it's going to work on the cough center, central nervous system. All right. Couple more. What's mydriasis?
The dilation of the pupil.
D for dilation, right? So bear in mind that cholinergic blockers have that effect on the pupil. All right, know your key terms. Remember I mentioned them again today about inotropic, chronotropic, and dromotropic. I want you to know what positive inotropic is. What does that mean? What does that mean? If you know that, you'll know the answer to that question. Beta blockers, whatever you want to say. You're still gonna think about what beta blockers do, right? They do a lot of things, but they slow what? What are they gonna slow down?
The respiration.
Heart, who said heart rate? You guys? Heart rate. Okay, so just like digoxin, remember we said you got to check your pulse? So what do we want that pulse to be?
60 to 100.
Yeah, we want it above 60 for sure. Yeah. So making sure that, as Vance said, the apical pulse, real word versus, what really goes on. But anyway, textbook, apical pulse. For how long?
A minute.
What should it be above?
60.
Got it. What if it's not? What are you going to do? What would you do? Would you give the med?
Stop.
I'll go get another nurse now.
Okay. Yeah.
Reassess.
Maybe. Would you give half the dose?
No.
Okay. Would you skip the med?
Yes.
Yeah. Now you hold it and talk to the physician.
Thank you. Would you notify the prescriber?
Yes.
Yeah. Maybe the dose is too big, right? Doesn't mean they don't want them to be on it. It means that you let them know, and they may say, oh gosh, didn't know that. We need to reduce that dose. But you would notify them first. Okay. Let's see. Anybody remember me briefly talking about Sjogren's syndrome? Sjogren's, dry, everything's dry. Remember, dry eyes, dry mouth. It's very dry sort of situation. So think about what would happen if we give something to help that. It would help with saliva, their dry eyes, all of that stuff. Wow, looks like I'm going to finish right in time. Okay, ginseng. Adverse effects of ginseng, please.
For the last one, are we thinking about what you would give to help with that?
I want you to know that if something was given to help it, what type of good effect should we see? Does that make sense? So if somebody's got all these dry stuff going on, if we give something to help that, what should the opposite be? If they've got a dry mouth, then we should see more saliva, those types of things, right?
Yeah.
Okay. I. Side effects of ginseng, please. Ginseng? And oh my goodness, people, know your intake and output. If anybody gets this question wrong, I don't even know. I'm probably going to get you to stand up, get on the table, and stand on one leg, and I don't know. I just don't know. Read the question.
Side effects.
Intake and output. I promise you should get this right. I know, should. Yes. All right. I think you'll do fine, yeah?
That's it?
That's it.
Did you say no to side effects of ginseng?
Yes.